very warm welcome to you. Thank you for joining us on Health and Wellness. And today is on the 31st, the very last day of the year. I hope you had a blessed year. My name is Zaitun Ali, and thank you for always tuning in every single Sunday from 6 p.m. to 7 p.m. on KTN Home. And on today's episode, we want to talk about wellness. The show is Health and Wellness, but most of the time, neither of you has ever asked me what wellness means, what health means. And we'll have a discussion right here with Dr. Tayo Opakunle, who is a general practitioner at the KTN Hospital. And he will talk more about wellness, being not just about weight balance, the physical fitness. It is holistic, and he will give us an insight about this. Welcome to the show.
Yes, pleasure to be here.
And I'll just start from the fact that our show is called Health and Wellness. Kindly differentiate and also give meaning to both terms.
Right.
Yes.
So, health, as defined by the WHO, is a complete state of physical, mental, and social well-being, and not just the absence of disease or infirmity. Now, where wellness comes in is that wellness is the active pursuit and maintenance of health. So, while it's possible for somebody to be healthy, they might not be doing any activities that help to maintain their health. But wellness is where your main focus is to stay as healthy as you can be for as long as you can be. And there are certain actions that you take with regards to wellness, which, as we'll go further over in the show, with regards to certain lifestyle changes or practices you can make in order to practice wellness.
So generally, it's just the day-to-day activities that you do to maintain our health.
Yes.
Okay, and perhaps what does this wellness entail? Does it have dimensions? Yeah.
So with regards to, there's the physical dimension of things, which is where you're taking care of your physical health. So this would include mainly things like your diet, your sleeping practices, and then ensuring that you're getting enough exercise. And then more so with regards to taking care of your physical health, going to the hospital when you're actually well for wellness checkups. So this also includes practicing certain activities that promote mental wellness.
Yeah.
So this could be opening up to people who you trust, journaling, doing things that get you inspired in life, things like that. Yes.
And you've actually mentioned about something that we are all prone to, stress.
Yes.
How is it? Is it a main factor, especially for maintaining our health and wellness? Because nowadays, I think the lifestyle has just changed, and stress, everyone experiences stress.
Yes. Yes. So stress can negatively impact your health, and it's very important that throughout your life, you know how to deal with stressful moments in your life. Because with stress, we can turn to certain negative coping mechanisms or habits, which then affect our overall health, which then can make the stress even more. Yes, so it can be a bit of a vicious cycle. So it's very important to know how exactly to manage stress. And one thing with regards to managing stress that I think is very, very important is actually being well rested.
Okay.
So practicing what's known as good sleep hygiene.
Which Nairobians don't know about. Really, we work day and night.
Yes.
Just to achieve a good living, eh?
Yes.
So sleep is really important.
Sleep, because with sleep, with good sleep, you'd have the energy to actually regulate your emotions, and things won't disturb you as much. Have you ever just started your day, you didn't sleep enough, and just the smallest things just annoy you so much? Irritation,
that is very true. But there was something I was saying about ADHD, the people who suffer from ADHD. When you're just about to go and sleep, your mind is racing. You ask yourself, did I remember to close the door? Who was talking about me today? People don't even like me. So things are going through your mind. You're not even able to sleep. You lack it as well. So for people who are suffering from that condition, how are they able to maintain the wellness?
So, as I mentioned earlier about sleep hygiene, one good thing to practice is certain winding down rituals during right before you go to bed. So this includes things like It's a way of telling your body, okay, it's now time to rest. The mind needs to calm down so that when we actually go to bed, we just fall asleep.
Okay.
And this would include things like removing all screens about an hour before bedtime.
An hour before.
An hour before bedtime.
We all sleep with our phones in our hands, you know? Every single time.
So this means no social media, no YouTube videos, no scrolling on some kind of website, nothing like that. And then, so once you reduce screen, then to also slightly reduce the amount of lights that you have in your house.
Lights?
Yes.
Okay, so they're also a factor.
Yes.
How should they be?
What they do is that the lights from light bulbs, they signal to our brains that we should still be awake.
Okay.
So when we dim down the lights, it tells our brains that okay, we can actually now it's time to rest. We can actually fall asleep now. And what will happen as you continue to do this is you'll notice that once the lights start going out, you start getting tired, you start yawning, you start feeling slightly drowsy. Yeah. And then as you're then heading to bed, just to do something like either you could read a book to help you fall asleep, or you can do a little bit of journaling, a little bit of mindfulness meditation, something like that, right before you go to bed. And then when you're actually going to bed, it will be very important that your room is as dark as it possibly can be.
Okay.
Yeah.
Okay, that makes sense. But there are those people who actually fall asleep when they watch a movie. So does this help? It might be comedy or something just creative that you like. Can this help?
Unfortunately, it's not advised because the lights from the screen will affect the quality of your sleep.
Okay.
Yes.
And for children, because I think I'm very guilty of giving my son screen time before bed, and it's a habit that he has gotten because he cannot sleep without. So that is something I need to stop.
I would highly advise it. Yes.
Okay. So for children, it's still the same case.
Yes.
Okay.
Yes.
And also about journaling, I might throw in the part of a therapist. Most therapists, actually I had a therapist a while back, and she was really advocating for me to journal down in case maybe you're feeling overwhelmed with your emotions and everything, just to journal down. So is therapy and therapy sessions part of wellness?
Yes, yes, because there's one interesting thing that therapists do in which one of the types of therapies that they do is called talk therapy, which is where you literally just go to the therapist and you talk to them, because there's so much catharsis, or essentially relieving so much pent-up stress and emotions when you just allow yourself in a safe environment to just openly speak about what it is that you've been going through.
Okay.
Because, and this necessarily doesn't have to be with a therapist. If you have good friends, if you have family members who you trust, if you just go and you speak to them about everything that you've been going through, you'll notice that there's a kind of relief that comes with doing that.
Yes, that is true. Someone who you don't know, who doesn't think maybe highly or lowly of you, so it makes sense. So perhaps maybe explain to us, when I come to you as a doctor and I want a wellness checkup, where do I start? Am I starting at the triage, just like any normal health visit? Yes.
So if you were to come to me for a wellness checkup, what would happen is you'd come to a clinic environment. Okay. So the first thing that would happen is you walk in, you speak to the receptionist, you say that you're here for a wellness check. And then from there you'll be told to go to the...
So it's a thing?
It's a thing.
Really?
Yes.
Okay, I'm here for a wellness check.
Yes.
Okay.
Because the main difference is that when you're coming for a wellness check, you're okay. There's nothing wrong with you. You're not having a cough, you're not having stomach pains, you're not vomiting, nothing like that.
So if I'm not okay, it means it's not a wellness check.
No.
Oh, okay.
That's when you'd actually need proper consultation and a workup and everything regarding what you're going through.
Yeah.
So if you're not having any of that, then when you come to the wellness clinic, you then go to the receptionist, you say you'd like to come for a wellness check. Then you'll then be sent to the triage area. So just like a normal doctor's consultation, the nurse will take your blood pressure, will check your heart rate, will check your oxygen saturation, ask you if you have any concerns that you'd like to bring up to the doctor. Then after that, what will then happen is you'll then be sent into the doctor's room. And the doctor at first will look at your vital signs, make sure everything is okay.
Yes.
And then with regards to your wellness, you can then discuss with the doctor everything that you've been going through and certain things that you would like to address regarding your health. And I really encourage everybody who goes to the hospital to ask as many questions as possible.
Yeah.
Because this is your health. Like, you only live once.
I know.
And so it's very important to take your well-being extremely seriously. So once you've then asked as many questions about your health, it would also be good to inform the doctor, of which the doctor will ask about your family history, if you have any medical illnesses that run in the family. So things like hypertension, diabetes, any kinds of cancers, asthma, if you've had any previous surgery in the past, things like that. Because this will then guide some of the tests that we'll order for you with regards to your wellness. And then, so after all of that discussion, then a physical exam will then be performed on you just to check different things, or if you're having any anemia, any jaundice, anything like that, if there are any lymph nodes you haven't noticed, any masses anywhere, if the sounds from your heart are normal, if the sounds in your lungs are normal, if there's anything unusual in the abdomen, things like that. And so after that's been done, then we'll then go for the tests. So the tests, most of them are just screening tests, of which essentially the essence of wellness is to see, are you well? Or if there's something going on, then we're catching it in the early stages where there isn't a major problem going on. So some of the tests that we do include things like a full blood count, a kidney function test, a liver function test, a thyroid function test. Then we'll check, we can screen for diabetes, doing a test that checks how your blood sugar has been for the last 3 months. You can also do a random blood sugar. We'll then also check how your cholesterol is. And then there are certain screening tests meant for certain populations. So for ladies, the things we have to watch out for are things like breast cancer, as well as cervical cancer. And the reason why there's an emphasis on these two is because they can be caught very early. And once caught early, they can be dealt with very easily. So for ladies with regards to cervical cancer, it would be important to get a pap smear done. So if you're over the age of 18, if you've never had a pap smear done, please have one done.
How is it normally done? Because I'm sure most of the people hesitate to go, perhaps thinking it's painful. How is the pap smear done?
So,
is it painful?
No, it's not painful. It's a little bit uncomfortable. But essentially what will be done is that a certain device will be used to essentially expose the part of the body known as the cervix. And this will usually be done by a female nurse. And then with a small instrument that's almost slightly like a brush, some sample of cells from the cervix will be taken.
And then they test it.
Yes, it's then looked at under a microscope. And if we see anything unusual, then we'll know what to do from there.
So it's something that you can go to the hospital, do it now, and you're done?
Yes.
Okay, that makes sense. And for men?
So for men, usually something we screen for quite commonly is issues to do with the prostate. Yes. So the way we do this is with a test known as the prostate-specific antigen, which is a substance that the prostate produces. And if it produces it in abnormal amounts, it tells us, okay, there's something that might be going on here. And then we also do a prostate ultrasound, which is, you know, the ultrasounds we use
Yeah.
for pregnant ladies
Yes.
to look at the baby? Yes.
So it's also done on men?
Yes, it's
Okay.
done for men.
Oh,
Yes.
okay. That's okay. And also, a question I had, is HIV and AIDS also a part of the test? For
Yes.
HIV and AIDS are part of the wellness test?
Yes, yes, it is. So, with regards to HIV and AIDS, is that it's entirely possible if you engage in certain habits that put you at risk
Okay.
of contracting the illness. So this would include unprotected sex with multiple partners, using intravenous drugs, you know, such as narcotic drugs, things like that, where needles are being shared. If you have contact with somebody who has the virus, and by contact I mean sexual contact, yes, so things like that. So it's entirely possible to be infected with HIV but not have any symptoms.
Yeah.
Yes,
Okay.
and so a screening test that's done, which is where we literally just look for the virus, then tells us if you have the infection or not.
Okay.
Yes.
For these wellness checks, perhaps, how long should I do them? In a year? Is it quarterly? Is it annually?
So I'd say the best age to start doing wellness checks is from, I'd say around 35, 40. Yes.
Really?
Yes, the best age really to start. You can start from as early as 18, but where the populations in which we start to see some of these chronic illnesses arise from starts from around 40 years old. I would advise that a wellness check is done yearly. Yes.
Yearly.
So every year.
Okay.
There's some tests which there's a certain duration in between which you can do them, but just with regards to an overall wellness check, every year would be good.
Yeah.
Yes.
And the importance of the same is, what is the importance of having these wellness checks?
Oh, so the importance of these wellness checks is that if we catch an illness very early, it's usually very easy to deal with, is the thing. Because essentially sometimes what we find catastrophic is, for example, if the first time you find out you have hypertension is when you've had a heart attack. And how we're dealing, we'll manage the heart attack first and then treat the hypertension later. But then, if you are having yearly wellness checks and we noticed each time, okay, your pressure is a bit high, we did some tests on the heart, we see, okay, there's some changes happening in the heart that are as a result of high blood pressure, then we can institute treatment a lot earlier, which will then hopefully prevent a heart attack from coming on.
Yeah.
Or if it does, if you do end up having a heart attack, we'd hope it happens much, much later in your life, such that it doesn't affect the quality of your life.
Okay.
Yes.
Okay, we want to take a short commercial break, and we'll be coming back with more from Dr. Tayo. And he'll let us know, what should I ask my doctor when I'm going for these wellness checks? And in case you have any question for him, 22151 is our SMS line, on Instagram and Twitter at KTN Home, at Ali_Zaitun. The hashtag is health and wellness, hashtag KTN Welcome Home. Stay tuned, don't go too far. Welcome back. If you've just joined us, remember this is Health and Wellness. My name is Zaitun Ali, and I'm still here with Dr. Tayo, and we've been discussing about wellness. And we are filming right here at the Hotel Troy in Mombasa Road. So thank you for joining us. And in case you have any question, remember 22151 is our SMS line. And even the WhatsApp line is on 0759 434389. As we're coming to the end of the year, next year we're doing it bigger and better. And on the 27th of January, we'll be having a health and wellness open day. So in case you want to be part and parcel, all medical organizations, the hospitals will be doing a medical camp. So reach out to us on WhatsApp line 0759434389 and let us know. We'll be doing it at our main offices in Mombasa Road. Karibuni sana. And Dr. you'll be part of this?
Yes.
KTN Hospital will be there? Yes, make sure. You're making a promise to the citizens. So come, get free checkups and even wellness. So you can get free consultations. Make sure to join us. So, Daktari, before the break, we mentioned about what wellness is, what kind of checkups that would we need to go and do, how long should we do these wellness checks. And right now, I want us to delve deeper into what other thing can I do just to maintain my wellness apart from the checkups. Yeah.
So there's this thing we call essentially lifestyle diseases. These are certain illnesses that come about as a result of the kind of life that you lead. And so it's interesting because if there are diseases that can come up as a result of how you live your life, if you live your life in a certain way, you can prevent the onset of these certain illnesses.
Yeah.
So the most common lifestyle illnesses that have really been emerging in developing populations, diabetes, type 2 diabetes, and hypertension.
There's type 1 and type 2.
Yes.
What is the difference between type 1 diabetes and type 2 diabetes?
Yes, that's a great question.
Yeah.
So type 1 diabetes usually occurs when somebody is not able to produce sufficient levels of insulin. And this we usually see mostly in children who have type 1 diabetes, where they have some kind of autoimmune condition that's attacking the organ that produces insulin, which is the pancreas. Yes, so that's mainly type 1 diabetes. So they require to be given insulin from an outside source. Now with type 2 diabetes, this is essentially known as insulin insensitivity. So the body is still able to produce insulin in type 2 diabetes, but the target point for this insulin is not so sensitive to the insulin. So it's like the insulin is not necessarily working very well. And this we usually see in adults who tend to be overweight or obese, very little physical exercise. They have a diet that's very rich in a lot of processed foods, especially carbs. Yes, that's who we tend to see type 2 diabetes in. So that's the difference between the two.
Okay. So that is about lifestyle. Diabetes is part of it.
Yes.
What else?
So, with regards to lifestyle, is that, yes, as I was saying, these diseases, their onset can come about if the way you live your life is not very conducive to health. So, that then begs the question, how should we be living in a way that promotes health? So they're very simple pillars. One of them is nutrition. So it's very important to eat a well-balanced diet that especially contains a lot of fresh fruits and vegetables. That is very, very important. And then with regards to eating essentially carbs, to eat carbs from a source that is complex, such that it's difficult for the body to break it down. So this would include things like brown rice, if it's going to be chapati, brown ugali, things like that. And then to eat protein sources, either from lean red meats, so meat that doesn't have too much fat in it, or white meat such as chicken or fish. Yes.
That's...
And then, so after nutrition, there's then also exercise. Now, exercise is extremely important because exercise has been shown to either prevent or prolong the onset of certain illnesses. And by exercise, what I mean, it depends on your level of ability to exercise. So if all you can do is walk, then yes, then do just that. If you can walk at a faster pace, do that. If you can jog, if you can sprint, if you can lift weights, if you can swim, if you can go bike riding, just any kind of physical activity is so beneficial with regards to not only your physical health, but even your mental health as well. Yes, our bodies were designed to move, so it's very, very important that you do just that.
Okay,
yes.
That makes sense. And it seems a little bit costly just to keep your wellness in check. So when I'm going for these tests, do you like have a package or do I need to do the tests independently?
So at the KTN Hospital Wellness Clinic, we have different packages that contains different number of tests. And now the thing with these packages is that the way that the packages are priced are at a subsidized rate to do all of those different tests. Because if we do the tests individually, then it will be very expensive. But if it's done as part of the different packages, then it's a lot more friendlier to your wallet.
Okay.
Yes.
Okay. And for those who are dealing with maybe terminal diseases, can they also come for wellness checkups?
Yes, yes, they can.
So for them, what's the procedure?
It would be exactly the same with regards to saying you want to come for a wellness check, seeing the nurse, then seeing the doctor. Because if somebody has a terminal illness, there's no need for them to unnecessarily suffer. Yes, so if something can be done in order to make the rest of their time a lot more comfortable, then by all means we should go ahead to do that.
Okay. And for expectant women, is also this termed as wellness when I go for my checkup? So that's just on another level on its own.
It's interesting because whenever we talk of wellness, we don't think too much about expectant women because expectant women, I guess, have their own form of wellness in the antenatal clinics that they go for. Because their obstetrician and gynecologist is ensuring that the pregnancy is progressing very well, there are no complications coming about, they're planning on how to give birth, whether it will be a normal delivery or via a cesarean section, things like that. And if there are any illnesses that come about during the pregnancy, such as something like a urinary tract infection or just any kind of infection, that they're taken care of. Yes. So in a kind of way, the antenatal clinics are kind of like wellness clinics for pregnant ladies.
For postnatal, they need to put therapy because it can be psychologically, it can affect you psychologically in terms of the changes in your body, the stress hormones is just way up, the baby is not sleeping, so I think that should also be included in the same.
Yes, I fully agree with you.
Okay, so anything else about wellness in terms of after the checkups and everything? So do we need to keep on coming back or talking to the doctor after we've done the checkups, or that is just it? Is there any other services that is done after?
So once you've done all of the tests and your results are out, the wellness doctor that you're with will interpret all of those results with you. And if you have any questions about what the results are showing, it would be very important to ask. So yes, and then after that, if all of the tests are normal, then we just say, hey, continue what you're doing, continue eating well, continue exercising, continue taking care of your mental well-being, and we'll see you in about a year's time again. But if we find something, then we will either have to refer you to the necessary specialist, depending on what exactly we find, or we'll just treat you outright if we find, let's say there's maybe a urinary tract infection, or somebody has H. pylori or something like that.
H. pylori is something that has been very common recently.
Why
is it so?
It's because it's a very easily transmissible bacteria because it's gotten by eating food from contaminated sources with the bacteria. So you're at risk of getting it basically anytime you eat out because we don't know how exactly the food was prepared. Yes. Okay,
that makes sense. And we've also talked about family history. How is it also a factor in terms of wellness, especially because for health we know Why is that? Why do we need to consider family history especially?
Yes.
Yeah.
So there's some illnesses that have a very strong genetic component to them, such that if your mother or father had it, there's a high likelihood that it may have been passed down to you, and at some point in your life, you may be predisposed to getting it. So this we usually see with especially cancers, such as breast cancer, cervical cancer, prostate cancer, certain kinds of gastrointestinal cancers can be hereditary, and so if there is a family history of these, then it's very important to get the screening tests that are associated with these conditions.
Okay.
So if it's breast cancer, we're talking breast ultrasounds or mammograms. The breast ultrasound is done in a lady under 35 years of age, and if you're over 35, then it's recommended you get a mammogram. Then for colon cancer, that we usually screen with either by doing an endoscopy or an endocolonoscopy after certain intervals. And if that is not for you, it's possible also to do a CT scan of the colon, essentially, to screen for such a condition. And then, yes, as we talked about with cervical cancer, pap smears, prostate cancer, prostate ultrasound, and PSA.
We've been talking about wellness. Is there a difference between wellness and well-being? Because we generally term those together.
The two kind of go hand in hand.
Yeah.
Whereas if your overall well-being is good, then you're most likely practicing wellness, essentially.
Okay, so they go
hand in hand. Yes.
Okay.
When you're doing very well, your well-being is good, which probably means you're practicing wellness, which they go hand in hand.
And we spoke about the diet, nutrition, fitness. There's people also do yoga. How does it help in terms of wellness? Yes.
So yoga is just it's exercise basically. It's a lot of stretching. It's a lot of holding certain poses, which helps strengthen your muscles, alongside some kind of cardiovascular activity. So something that gets your heart pumping.
Okay.
So usually I recommend about 100 to 150 minutes per week of moderate intensity exercise. So this could be either brisk walking, such that you're walking such that you build up a sweat, or you can jog, or you can swim, or you can ride a bike. Yes. The main thing is just to get the heart going. And of course, if you enjoy playing any sports like football or basketball, those also definitely count and are very helpful.
An advice to those who don't do any physical fitness, they don't do yoga, but they feel that they are just still healthy and going strong. So what would you tell them?
I would tell them it's a harmless addition, and even if you're feeling good, you're healthy, everything, without doing the exercise, I mean, you could feel even better if you add it if you make it a habit.
Yeah.
Yes.
Okay. So when we're talking about wellness, there's gender discrepancy because women tend to come for wellness checkups more than men.
Yes.
Why is this the case?
Women tend to take their health very seriously.
Really?
It's not that men don't.
Yeah.
But studies have shown that there is reduced what's known as health-seeking behavior, especially in the male populations from around the ages 35, 40 till maybe like about 50, 55, around there.
Yeah.
And the studies have clearly shown that women in that age group, when there's anything going on with their health, they're much more proactive than men are. Yeah. They'll go to the hospital and see a doctor as needed. Whereas with men, there's a bit of a tendency to be like,
so I'll be okay.
Yeah, it'll pass. Yeah, I'll be fine tomorrow. Maybe I'll just take a couple of these medications and then it will go.
Yeah.
But overall, it's just, if there is anything going on, it's just very important to go and see a healthcare professional to know exactly what it is.
Yeah.
Yeah. So I'd encourage all men, regardless of age, to take your health very seriously.
Yeah.
Go for wellness checkups because it will benefit you in the long run. Yes.
And when they're coming to just get checked, is it only the hospitals that provide for these services, or other people we can get the services elsewhere?
Right. So yes. So at the Karen Hospital, we
Yeah.
offer wellness checks at the main hospital, but we also offer wellness checks in our different satellite clinics in Meru, Karatina, Nyeri, Nakuru, all of the different satellite clinics that we have.
Those
Yes.
are within the, actually even right here in Magadi Road, I think there's one in Rungai.
Yes.
Yeah.
Yes. Yes.
So
You can get a
those ones
wellness
are
checkup there.
within
Yes.
the community.
Yes.
Okay, no problem. Thank you so much. So they can just reach out to the hospital in case they need to find you or any wellness professionals there?
Yes.
Right, okay. So perhaps the website for Karen Hospital, you
Yes.
can just let them know.
Yes.
Yeah.
So the website where you can find us at is www.karenhospital.org.
Okay, thank you so much. Thank you so much for coming to the show and giving us insights about wellness. So we've seen the importance clearly, and we've been filming here right at the Hotel Troy in Magadi Road. And remember to catch us also next year. Have a happy, happy new year. And in case you missed this episode, it will be uploaded on YouTube at KTN Home. My name is Zaitan Ali. Stay tuned. God bless you.